here, what we're going to have is we're going to be sending a resource. Which resource? The doctor, to another seized resource unit, which is the scope. So the doctor is seized by the patient. They've been reserved by the patient. And they're going to go pick up an item from another pool, from the scope pool, that has been seized by that same entity. And they're going to go fetch it, okay? And that's specified in these two pieces here. So the doctor is going to fetch the scope. Both of them have been seized. You'll notice, by the way, that occurs after network seize, because it's dependent on them having seized it. Okay? You can, in fact, use this network send to, in some cases, to move several things. So, for example, if you look at the next one, send to patient, what's going on here is that the seized resources, the doctor and now the scope that the doctor retrieved, are going to be moving to the entity. See that? So before, they moved to the doctor moved to the seized resource unit, to scope. And now both of them are moving to the entity with which they're associated. So, in short, the seizing associated the patient, the entity, with the doc, the scope, the procedure room. We sent the doc to get the scope, both associated with the same entity. Having reached that, the doctor and the scope make their way to the entity. The scope can do that because it's with a moving resource. So the doc can carry it. It's a portable resource. You couldn't carry an MRI, for example. So there we've sent it to the patient, okay, to the entity. Okay.